It is said that life is not about getting and having. It's all about giving and being. Today, we are talking about such a personality who is contributing his part very well in our community. The only motive of his life to serve the people with his talent and wisdom. He is an eminent joint replacement surgeon of our country, residing in New Delhi. He doesn't consider his profession as a job. He treats his patients like his own family members. Now it's time to meet him. He is Dr. Nischal Chugh.
I am Dr. Nischal Chugh. I did my graduation, that is MBBS, from Guwahati Medical College. Thereafter, I appeared in postgraduate All India entrance examination and I scored 23rd position, and I took Orthopaedics in Delhi. After my post-graduation, I did my senior residency from Hindu Rao Hospital, and thereafter I went to England, completed my MRCS and did some of my fellowships in joint replacements. In 2005, I came back, and thereafter I have been practicing in Delhi. Since 2005, I have been trained by various surgeons, but most prominent being Dr. Pradeep Sharma.
He takes care of thousands of people with his experience, whether in his clinic or in his hospital.
So I have taken up 3 fellowships in Australia, in Brisbane, in Adelaide and in Sydney, and I did 1 fellowship from France and 1 fellowship from UK. I also spent some time in New York and in Los Angeles. This has added greatly to my experience. At present, I am working as head of the department of Max Hospital Pitampura, and I have a team of 5 people.
While visiting in the hospital, he also takes care of every single details. He notes down the things which he feels necessary. He also owns his clinic, from where lot of patients are being helped.
I specialize in the field of joint replacement. I can tackle any kind of hip and knee replacement surgeries. To my credit is somewhere around 2,500 knee replacements and about 1,000 hip replacement surgeries. I have done some of the revision hip and revision knee surgeries as well. The revision surgeries, they require a special kind of perfection as well as clinical acumen, which we need to modify at the time of doing the surgery. I have done 3 reverse shoulder replacements, which is one of the great credits which very few people in India have done. I have done 3 elbow replacements as well, which is again a very rare surgery. Moreover, these joints can be compensated by other movements as well, whereas in the case of hip and knee, these being the weight bearing joints, these cannot be modified. There has been a revolution in knee replacement surgeries because now we have come up with a knee which can last for more than 30 years. Now this is a change which we are going to see over the period of time. This knee by the name of Oxenium has been invented by Smith & Nephew company, and I did some of these replacements in England long back in 2004-2005, but they were launched in India in 2009.
he always cooperates and appreciates his team members. The practice of Dr. Nischal Chugh is being continued with the latest technology and equipments. He studies his every case very carefully.
For knee replacements, for younger age group, we have unicondylar. Unicondylar means half knee replacement. The patients with half knee replacement, there are few patients who are Muslim patients, few patients who are gardener by profession. That means that kneeling is part and parcel of their everyday schedule, and they can do this with a unicondylar knee. Now in hips, we have uncemented hips with large diameter head. If I may explain, then this is the cup, which is an uncemented cup. So it has a coating of an artificial bone. This gets blended with our normal bone, and once it gets blended, it can last for lifetime, maybe 30 to 35 years or maybe longer. Now once these hips are fixed, they have a pretty long life. This is a poly which is in between. This is high density polyethylene, and then we have a large diameter head. So once this head goes in, you can have full range of movement and it will never come out. So this is the thing which we need to do. Normally, if we do a small diameter head, then this would be the cup and this would be the small diameter. So with the small diameter, the problem is the moment the patient wants to squat, it comes out. Or the moment the patient sits into a palthi position, it again comes out. So this is the advantage what we have with a large diameter head. It never comes out. It never comes out. It just stays there no matter what movement you gain. Similarly, in hips we have uncemented stems. Again, they have the similar coating, or we have the cemented stems. Cemented stems are used usually for people who have more age, more than 60. Who are younger, we use the uncemented stems. So these are the few designs for hips. Similarly, we have come up with metal on poly. So we have another one which is oxenium. Oxenium is like a black metal. So oxenium does not wear, so it has a more longer life. Similarly, the same material is being used for oxenium knees as well. So this is oxenium knee. So that's how it lasts longer. It doesn't wear.
During practice, so many people are come up, and some of them becomes memorable with some interesting incidents related to the cases.
Some of the cases which always make a mark on our mind. One of such patient was Mr. Nityanand Sharma. He was more than 60, very active, severe varus deformity, but still walking. He had pain, but still he was walking. I still remember, third day post surgery, our MS went to his room and asked that where is the patient? And he was taking out clothes from his almirah, bending down with his knees bent, and he was taking out the clothes. And MS went and said, where is the patient? He said, I am the patient. He said, you have been operated 3 days back. He said, yes, I have been operated 3 days back. So what are you doing? I said, I am fine. I want to go home tomorrow, but doctor is not relieving me.
I was having this knee problem for more than 30 years. So Dr. Chugh, when I met with him, he said that I'll do all the things. I went there, and next day I was operated. On the 4th day, I myself was able to stand and walk without any help.
Similarly, I still remember a patient, he came from Ramnagar near Jim Corbett National Park. He had some pain in both his hips following a fall. Some people got X-ray and they said that both his hips have been fractured. He started from Ramnagar and he came to Delhi, and it took 15 days. He stopped in between at various centers. His weight was 130 kg, his age was 32, and nobody was ready to operate him. The reason? Because nobody could identify that why his hips got fractured. When he came to me through a reference, I got him investigated. It was Cushing syndrome. It is a syndrome in which the patient becomes very fat. It is a hormonal imbalance. Now at the age of 32, if you have to operate, you want to do a hip which should last his lifetime, supposedly. If not lifetime, it should last till the time he has his productive life. So we opted for an uncemented large diameter hip. It has been now 6.5 years. He got married after his both hips replacements. He got a child, and now if you see him walking, you can't say that his hips have been replaced. So at younger age group, you should start exercising. You should not become overweight. You should have the habit of walking.
So, the practicing philosophy of Dr. Chugh is now very clear to all of us. There is no need to say anything else after listening to him. The way he meets, talks and treats is very helpful for his patients to become satisfied and convinced. So many people have benefited only because of his experience. Now the turn is yours.